Okay, the recording has started. I'm going to ask everybody to put their faces, put your video on, just because I feel like I'm talking to no one. So I want to be able to see your faces and be able for you to, talk back or ask questions or whatever. So, okay, so here is how the evening is going to play out. I know I scheduled the time from 6 to 8, but I recognize that you all have been in school all day. You're probably a little bit brain dead. And so what we're going to do is we're going to break these sessions apart. And that what I mean by that is tonight we're going to go over burns. And that's all we're going to go over is burns, because that's a content in and of itself. We're going to go over the major content of burns that you need to know. So I'm only going to be talking to you and teaching you and you having a discussion with you about what you need to know for the test. So whatever I'm talking about is all you need to know for the test. And the test, I'm taking the information from your book, from the ATI book, and the workbook, that if you all have received that. That's the only place I'm taking the content from. And I've cross-referenced your book with the ATI book to make sure that the content that I'm presenting to you doesn't have any contradictions or areas where it's like, well, this says that, but this says that over here. So I tried to stay away from anything that looked like it might have been a conflict. Okay, so what I'm going to do is we're going to talk about that. I'm going to show you some PowerPoints. We're going to go through those. And then as per usual, we're going to go through some questions. When we go through the questions, we're going to break those questions apart. I'm going to tell you this is an analysis question. And so what I want you to do is then be thinking about analyzing the information and then answering the question based on your analysis. Or this is a priority question. And then we're going to look at what that looks like so that you get in the habit of reading the questions with that lens. This is an understand question, and then how you apply the information that you already have to this question, or this is an evaluation or whatever. So we're going to do that. Then what I want us to do after is after we go through the questions and we break them down, then I'm going to have an open forum where you can ask me questions, and I'll answer them to the best of my ability. You know, I don't know everything, but I'll give you the best that I have. And then what I want you to do for the rest of the time, because I think that'll probably take up about maybe, I don't know, 90 minutes, maybe not even that, maybe an hour. What I want you to do with the rest of the time is look up for tonight 10 questions just on burns. Do those questions. Look up NCLEX questions. I don't care where you get them from. Just do 10 questions just on burns, because I want you to lock in that information on burns. Then tomorrow I am going to offer another session. That session, and we'll talk about what time that can be, or it could be Saturday, but we're only going to do, again, maybe an hour and a half. And at that session, either tomorrow or Saturday, whichever the larger group, the majority rules on, then we're going to talk about shock. And that's all we're going to talk about is shock, the different types of shock. And then we're going to do the same thing. We're going to go through the shock PowerPoint. We're going to go through the shock questions. We're going to dissect those questions. And then I'm going to have you do on your own 10 shock questions. And so that's how we're going to go through the content. I did talk to Professor Johnson today, and she said that she had started to compose the test. I told her I was going to be creating the test based on what I am lecturing on. And so she told me that she already had about 30 questions, she said, on that included the bites. She said it did include the snake bites and the dog bites and I think the tick bites or whatever. So she says she did do that. And so I don't know what she lectured on. I said, did you lecture on what you're giving them on the test? And she said, yes, I did. So we'll talk about that in a minute. But I want to be helpful there as well. But I told her that I was going to create my questions from my lecture and our study session tonight. I'm going to pull them directly from what we talk about, what's in the PowerPoint. And I have created the questions already in the test to match what I'm going to talk to you about tonight. Okay. All right, so let's get started. Everybody, please put your faces on the video because I'd like to see you. And then that way, if you have questions, I can see your faces. I can read your faces like, I didn't quite get that or whatever. So I'm going to be looking around. So if you put your lovely faces on, that would be great. Okay, all righty. So let me share my screen with you. And anybody have any questions before I get started? Are there questions? Tell me how you have been studying. How have you been studying for the content? I know you've been studying on your own. I know you're not really gleaning. I've heard from enough of you to know that you're not really gleaning a lot from the lectures that Professor Johnson is giving. But how have you been studying the content for Burns, for instance? How have you been doing that?
Me and Joyce did some dynamic questions together.
Okay. Anybody else?
Simple nursing.
Simple nursing, listening to that. Okay. Anybody else? Has anybody done any? Oh, somebody was.
Yeah, it's me. I listen to Sarah RN, and at the end of each lecture, she has questions, and I take those questions.
Okay. Okay. Anybody else? Anybody else been doing questions on their own with an NCLEX book or anything like that?
Yeah, I've been doing that.
Okay. Okay. Has that been helpful? Do you feel like you have a good grasp of information on the burns? Everybody feel pretty good or don't really know what to be studying, just kind of casting your lots and how you've been studying? Yes, no? Okay. What have you been gleaning from the lectures? And I know you'll say not much, but tell me, what have you heard from the lectures that you, from burns? What do you know from the lectures about burns? Anybody? Nobody? Nothing? No? Okay. All right. Okay. All right. So let's get started. All right. Let me share my screen. Okay. Please tell me when you see what I am showing. Yes?
Yes, we can see it.
Yep.
Okay. Okay, very good. Very good. Okay. So, like I said, for tonight, we're going to talk about the burns. We're going to talk about the classifications and the stages, what to look for. We're going to talk about the rule of nines, the Parkland formula, the specific meds that you would give for somebody. We're going to talk about the stages, not stages, rather, the phases of burns as well. Tomorrow or Saturday. And let's settle that right now. How many would be able to join on tomorrow at 5 o'clock?
I'm available.
Okay. Anybody else?
I can
I
I can do that too.
Okay.
me too.
Okay. Okay. I've got 1, 2, 3, 4, 5. I think 6. 1, 2, 3, 4, 5, 6, 7, 8. Okay. All right. So we'll schedule, I'll schedule another Zoom meeting for tomorrow evening at 6 o'clock, and we'll do the shock. And you see there what we're going to go over because that was on your study guide anyway. Okay. All right. Okay. Okay. So first I want to talk to you about the various types of burns. Okay. So you know that you have, and this is going to be helpful for you because when we start talking about the types of burns, I want you to be able to take away what you are going to know about the appearance of those burns, what you're going to know about how to treat those burns from a nursing perspective, what patient education you are going to give that patient about that particular burn, okay? And then any other considerations that the nursing interventions might drive you to do. Okay, so the first degree burns we're going to talk about, and those are basically your sunburns. You put your hand under some hot water, you got scalded. What am I expecting to see? You've all been burned. We've all touched something. We've all turned the water on and it was too hot. You've had sunburns. What does that look like? Because those are your first degree burns. What are you expecting to see? Are you expecting to see redness?
Yes.
Blisters.
So you may not see blisters. You might. It's moving into a second degree burn if you're seeing blisters, but yes, you might see some blisters. You're definitely going to see some redness. What else?
Blanchable redness.
Yeah. Are you going to, is that going to hurt?
Yes.
Okay. It's going to be painful. Why?
Because it's either
Because what's lying under your skin? What's lying under your skin?
Nerves.
Nerves. Okay, so if you've gotten that first layer and the nerves are right under that, right? So what's the first layer? The first layer is the epidermis. That's the epidermis. Epi meaning above, dermis meaning the skin. Okay, epidermis, that's the first layer. What's the second layer?
Dermis.
The dermis. If the epidermis, right, is above the dermis, then the dermis is the second layer. Okay, so these, the first degree burns, those are the sunburns. The next day you're like, woo, that really burns. That really starts to itch maybe sometimes after. You're gonna have some flaking or some peeling or whatever. What is going to be the treatment? So you have a mom that lives next door to you, and she was outside with her kid, and she laid in the sun a little bit too long, or she ran some water and she burned her hand, burned her on some hot coffee. What are you going to tell her to do for that burn? Because it's kind of red, doesn't really have any blisters, it's not swelling, nothing like that. What are you going to tell her to do for that burn?
Soak the area.
So what are you going to soak it in?
I would say room temp. Not too
Okay.
cold, hot.
Why not too cold, Aaliyah? Why not too cold and not too hot?
I don't know. I don't know that part.
That's okay. Let's think
I
it
just
through.
know what to do.
Let's think it through. So, okay, so somebody said lukewarm water. Okay, so I burn myself, whether it's a sunburn or it's a burn from some water or some hot coffee. I don't want to do ice because ice can burn, right? That's going to increase the level of the burn. So I'm not going to put any ice on that because the ice is only going, because if you put ice on something, it can burn you as well. So I would stay away. The literature says you would not put ice on there, but you might put something cool. You might put something lukewarm. Why nothing hot? Because you just got burned by something hot, right? The sun or the water. So am I going to put something hot on it? No, I'm only going to exacerbate the heat that is already burned my skin. So I'm not going to put anything that is too cold or too hot on the burn. I'm going to stay away from that, put something lukewarm or cool on the burn. And maybe I'll put some ointment on something for burns or whatever like that. Okay. So that is going to be your superficial because it's not going into any of the layers of the skin. Does that make sense? So that's going to be your superficial burn. All right. So now when we move to the second degree burn, okay, so that's, I really scalded myself with some hot water, or maybe I got burned by fire actually, or something else. Okay, so now what does that burn going to look like?
Blisters.
That's the burn that's going to be blistering, right? So you're going to get that blister, that big old bullous that has probably fluid in it. Have you ever seen that? Yeah. So you know that if you kind of touch it or move it too much, it'll burst, and that'll be just kind of clear fluid coming out. So you're going to see that. You may see some mottling. You may see some swelling with your second degree burn. Why do we call it a partial thickness? Think about it. Why, when we talk about thickness, we're talking about the skin layers. So why do we talk about partial thickness?
It's only to the dermis.
But it's not fully,
Correct.
completely. So it is a partial thickness burn, right? Because it has now gone into a portion of the dermis. All right. So that's where that partial thickness. Now we're going to move. So we'll talk about the treatments for partial thickness and full thickness, but let's talk about now the 3rd degree burn. So now we've got some full thickness burn. So now where is that burn? Why do we call it full thickness? What layers is it now invaded?
Sub-Q.
It has invaded the epidermis, the dermis, and now the subcutaneous. So now it is full thickness burn, and that's why they call it that. Okay, so anything can cause that, basically a flame, hot liquids, electricity, chemicals, anything like that. And then there's some, your skin is going to be leathery. It might look charred. It might look white. It might look super red and angry. You're probably going to have some swelling there. And so you may have some blackness, which is called eschar. You may have that. And you may need to have a skin graft because that burn is a pretty serious burn. And then you go to the 4th degree burn, which is full thickness. Now that is also called full thickness, but what now? And you can look at the chart. Where has now it invaded? It's gone all the way from the epidermis all the way down to now to the muscle and or bone. So that's really, and am I going to feel that? Am I going to feel that burn? Am I going to have pain with that burn?
No.
Why? Why am I not going to have pain with that?
The nerves are dead.
That's right. I've killed my nerves. So I'm not going to really have a lot of pain. But what do I need to be worried about with that full 4th degree, full thickness burn? So it's gotten my, let's just talk about what it might do to the layers. Okay, so the layers are now gone. They're burned, and it's gone all the way down to my muscle. The muscle is going to burn through my muscle. So what do muscles need to be able to be developed properly and be strong? What do they need? What elements do they need in your body and nutrition wise? What do they need?
Protein.
Protein, exactly. So it's going to now, my body now is going to require that. So now when I'm moving into my nursing interventions, what do I need to be aware of for my patient's intervention other than managing their pain? What do I need to be looking out for?
Dehydration.
Dehydration, yes, because they've lost also fluids. Okay, but what else? And we're talking now nutritionally, because I got to think about all of these things. I got to think about they're in pain. How am I going to manage?
High protein diet.
That is correct. Who said that? Janae?
Janae, yes.
Yes, that's right. So my patient is going to need a high protein diet. What else are they going to need? Not just protein, but what else? What else gives you energy? What else helps things to speed up and to come together to feed the cells?
Calories.
Carbohydrates.
Also correct, carbohydrates. So they're going to need more protein and they're going to need more carbs in their diet. So if you see a question like that talks about what kind of nutrients, what kind of nutrition are you going to promote with your patients, it's going to be protein, right? And it's going to be carbohydrates. Okay, so somebody mentioned that when the patient has burns, they're going to get dehydrated. That is correct. Why? Why the dehydration? What does the skin do for us? What does this covering do for us?
Protects us.
It protects us, exactly. So when that protection has been compromised, we're going to what? Start to lose fluids because the body now has been attacked, right? The fluids are going to start moving out where they usually live, out into the what we call the interstitial space, right? You're going to be losing fluids all over. The body now has gotten deranged because now all of those things that it normally regulates now are deregulating. For instance, if I've been burned over a significant portion of my body, my temperature regulator is not going to work. So what do I expect to see in somebody that's had a significant burn? What might I see in terms of their temperature? Is it going to be too low? Is it going to be too high?
High?
Why would it, tell me, let's talk it through. Why would it be high? Because remember, my temperature regulator is now going to be thrown off. So when somebody gets burned, do you want to cool them down or do you want to keep warmth in? Because remember, the protective layer has been compromised, right? I burned a significant portion of my body. So that which now insulates me is now gone. So am I going to be wanting to keep warm or do you need to cool me off?
Warm.
You need to keep me warm, right? Okay. That goes all the way through to the fluids that you're giving me as well, because I'm going to be losing heat from my body, which means that my temperature is going to start to be a little low, not too high, but too low, because I'm losing heat because my insulator has been compromised. Does that make sense? Any
Yes.
questions? Okay, so moving on. Okay, so then since my outer layer, my protective coat, which I'm calling my skin, has been compromised, I'm losing fluids from my body because of the shifting of the fluids in my body. My cells are now, potassium now is weeping out of my cells. It's supposed to live in my cells. Now it's moving out of my cells. All the fluids that should be in their regular places are now moving into my interstitial spaces. So what, for somebody that has a significant level of burns, what might I see? What presentation might they have in terms of, are they going to be, well, yeah, how will they look? What might I see other than the burns? What might I see? Because remember, the fluids are moving out of the cells, out of where they're supposed to be. Where do they go?
Blister?
Somebody said edema. Yes. So you're going to see maybe some edema in their skin. You probably will see that because of that fluid shift. Now, remember, I told you that the fluids are going to be shifting out of the places where they should be living into places where they shouldn't be living. So potassium, I want you to remember this all, but remember that potassium is one of those electrolytes that moves out of the cells. And so it's going to move into the interstitial space. So would I expect my potassium to be low or high?
High.
Is it going to be high? Tell me when.
Isn't it? They're gonna be hyperkalemic first, and then eventually they're gonna go back to hypokalemic.
Yes, that's right. And that's the reason why. Yes, because so what do I need to give these people that now have compromised their coat, their outer coat, the skin, right? What do I need to give these people that is going to make those fluids shift the other way and go back to where they belong? What do I need to give them? Because now they're losing potassium, sodium, they're losing, glucose, they're just losing all kinds, they're losing chloride, they're losing the electrolytes. So what fluids am I going to give?
LR?
Correct. Why LR?
Because it has like some electrolytes in it.
That is correct. That is correct. So I would give them LR, or what else can I give them?
Normal
5%.
Normal saline, 0.9 normal saline. I'm going to give them either normal saline, but LR is probably the better one because especially if their electrolytes are thrown off and if they've had a significant amount of burns, It probably is. So they would get LR. We're going to talk about how much LR, how much fluids and all of that when we talk about the Parkland formula. But I just want you to know that the fluids that they're going to get initially is going to be LR. Am I going to just take that LR out of the Pyxis and hang it? Because remember, I told you that they're losing, not only are they losing fluids, but what else are they losing?
Electrolytes.
Well, yes, along with the fluids, but they're losing body heat, right?
Yeah.
So remember we talked about keeping them warm in all ways. So not only am I going to make sure that, how do I make sure that they stay warm? What are some interventions that I can do to make sure that the patients are staying warm?
Can you do
Bear
like
hug.
fluid warming?
I'm sorry?
Can you do like fluid warming?
Absolutely. We have fluid warmers. That's exactly right. So we would give them warm fluids, not cold fluids. Okay. What else can we do to ensure that there is the room? Well, I just said it now. The room is warm, the temperature. What else can we do?
Bear hugger.
Yeah, right. If they need that. Yeah, exactly. So we want to make sure that everything is warm because they're losing body heat and they're losing fluids. So fluids, warmth are things that we are wanting to do as nursing interventions. So let me go ahead to the next slide. Okay, so let's just take some visuals and look at the first degree burns. So obviously we said these are superficial burns, and this one over here on the right-hand side that has a little bit of blister, sometimes you're living on the edge with the first and the second degree burns, but that's that little bullous that I was telling you about, that if you probably touched it too hard, it would burst and it would weep just clear fluids. So this is the first degree burn. Do those usually resolve pretty quickly?
Yeah.
Relatively quickly. Yeah, I mean, you might have some peeling. You've all had sunburns, right? How long did it take for those to resolve?
A few days.
A few days. What did it feel like as it was healing? Did it feel scratchy,
Like a
itchy?
rug burn.
Like a rug burn. That's exactly right. That's exactly right. You didn't really want to put clothes on it, right? Because it was sensitive, right? So this is going to be your first degree burn. And then let's move over to your second degree burn. So now we're getting into, what did we say the thickness was?
Dermis.
Partial thickness.
Partial thickness. And why is that partially thick? Why do we call it that?
Because it goes into the dermis.
That is correct, because we have now partially intruded into the dermis, which is the second layer of the skin. So we've got the epidermis, the dermis, the subcutaneous, and then you get into the muscle and the bone and all of that, and that's really bad. So these are pictures of your second degree burns. You can see down at the bottom one where you do have those blisters. Should we be popping those blisters?
No,
Why?
it stops the healing process.
Right? What else might it do? So now that I've compromised, remember now, let's think about the whole picture. I've compromised my coat. So now my heat is going out. My fluids are, I'm losing fluids. What else is compromised?
Immune
Remember,
system.
my skin is my protective layer. What did you say, Aaliyah?
Immune system.
My immune system. Why? Is this an area for, if I've broken down the first layer of the skin going into the second layer, it's an avenue to introduce what?
Infection.
Right, that's right. Bacteria. What bacteria lives on my skin? Anybody know? Staph. Nasty infection. So we don't want to pop those blisters. We don't want to do anything with those blisters. We want to make sure that we have the correct creams and emollients and all of those things to treat that, because that we have now broken the layer of the skin, and now that is a great avenue for infection. Okay, because we talked about those burns, and we're getting ready to go into the third degree burns, and we talked about there's some swelling that goes on. Can you see on the left side, that hand, does it look swollen to you? It probably
Yes.
does. Yes, and it looks white. It's kind of blanched and it looks white. The one down at the bottom, you can see how now the 3rd-degree burn and the picture of the skin, you can see how it has gone all the way down. And the yellow stuff that you see down on picture B, down at the bottom, that yellow stuff, what is that yellow stuff?
Ah,
That's right. That yellow stuff is your subcutaneous fat. So up here where these little hairs are coming out, that's the dermis. And then the next layer is, I'm sorry, the epidermis. And then the next layer is the dermis, the thick layer. And then down you get to where the subcutaneous fat is. So this is what kind of burn? We know it's a 3rd-degree burn, but what thickness? Full thickness, and you can see why, because it is going all the way down to the subcutaneous fat. Okay, all right. And now here's the 4th-degree burn. Okay, so we talked about now it's going to involve every single layer of the body. You may have some black, so that means what's going to happen to those fingers or the tips of those fingers? Is any
Necrotic.
blood? I'm sorry, what did you say?
Their nerve endings are probably going to be dead.
So is there any blood flow getting to those areas?
No,
So what do
They're
you
gonna-
think is going to happen to those fingers?
necrosis.
Necrotic.
mutation.
Necrotic,
gonna
they're
fall
already,
off.
they're going to either fall off or they're going to get taken off. Yeah, because because there is no blood flow to those fingers. You got eschar now there, that's that black. And so there is no feeling at the tips of those fingers. And so if they don't take that off, that will spread, right? You can see the picture, the 4th-degree burn down on the right-hand side. That hand got swelling. You can see the fingers are fat. They look really, really fat. And that all the layers are gone. You can see the yellow layer. So that all the layers are gone on that 4th-degree burn. And so I'm not sure that they're going to be able to really save that hand. And I'll tell you a little story. My brother, my oldest brother, he's 11 years older than me, but when he was in his early teens, he was playing with some matches and some lighter fluid. Sometimes boys like to be like want to be arsonists, and so I guess maybe that's what he was. I don't know why he was playing with fire, but anyway, some of that lighter fluid fell in his pants. And he was lighting matches. And of course, as you would have it, the match caught a hold to his pants. And so his pants caught on fire and he caught on fire and he began to run. What do you think the running did?
Did for the fire.
It fanned the flames of the fire. That's right. And so my brother ended up having 3rd and 4th-degree burns on from his knees down to his ankles. 3rd and 4th-degree burns. He lived in the burn center for a long, long time, and he had to have skin grafts from his chest, from his inner thighs, and his back. And so luckily, he did not lose his mobility. He walks, he runs, and he never lost use of his legs, but he definitely has the scars to show for it, like this little girl up in the right hand upper corner. His legs are disfigured, but he never lost the use of them. So yeah, the burns are and he had to have lots of fluids and had to have lots of skin graft surgeries for that. All right, let's go to the next. Okay, so can everybody see? Have you heard of the rule of nines? The rule of nines is something that you're going to want to know, because the rule of nines is how you calculate and estimate the percentage of the body, the total surface area of the body that has been burned. They call it the rule of nines because each of your area, with the exception of the neck here, which is 1%, is some increment of 9. Okay, so both of your full arms are 9. Okay, but half of the arm, the forearm all the way down, is half of your arm. So what would that be?
4.5.
percentage? Yeah, 4.5. Okay. So, but the whole arm is 9. The legs are 18. Why do you think the legs are 18?
Because they're longer? I don't know.
No, not necessarily, but because we have anterior and posterior, right? So our legs, the front is 9, the back is 9. So the total leg is 18, right? So, okay. So if I had, oh, well, it says it here. If I burned both of my legs, front and back, what percentage of my total body would that be? Anybody? So remember, I'm going to
36.
add. That's right. I'm going to add. So, all right. So 36. So if I burn both of my legs front and back, that's going to be, I have 36% of my body that has been burned. 36%. Now let's add on. If I have both my legs and both my arms, what percentage of total body surface area have I lost, or have I burned?
54.
Yes, exactly. So that's how you do that. Okay. Now the front and back of your body, the torso, the front is worth 18, the back is worth 18. So if somebody said that they have over 40 or 36% of their body, then you would get that by adding the various areas. So if you saw somebody and they had burns on their this part, the forearm of one arm, right? Their torso in the front and one leg, how much percentage would that be? Remember the forearm, that's 4.5, right? I'm sorry, 4.5. The front torso is 18 and one leg is 18. What percentage?
40.5.
Right. So that's how you calculate that. So remember the rule of 9s. You'll probably have questions about a person has burned over 36% of their body or whatever. You might have a question about the rule of 9s, and this should be able to help you to calculate how to do that. Any questions? Okay, moving on. All right. So the burns have phases, and so the first phase is the.
I have a question.
Yes.
When we're talking about the legs, are you gonna specify on the question that is the posterior and anterior? When is the 18, or you're gonna say like only the posterior, then it's gonna be the 9?
If I had a question on there, it would specify it was the entire leg, or yeah, if it was the anterior or posterior. Yes.
Professor,
Yes.
I saw on Simple Nursing the same kind of picture that you just showed of the rule of 9s, but it showed that the genitalia was worth 1, but on the one you just showed, I noticed it was on the neck. Are we going by the one on the neck?
You know
It
what?
doesn't matter.
You won't, yeah, it doesn't matter.
Okay,
you won't,
thank
yeah,
you.
you won't have to calculate that. Yeah,
Okay.
but you're right. That is 1, and then the genitalia is 1. Yeah. Okay. Any other questions? Okay. So the burn phases, the emergent, and this is also called the resuscitation phase. This happens within the first 24 to 48 hours. Okay. This is where if somebody is really, this is where you really need to be watching these patients. You need to watch them in all phases, but this is where you're going to make sure that their airway is secure, that you're giving them the fluids that we talked about, that you're managing their pain, that you're preventing any infection, that you're maintaining the body temperature, and you're providing any emotional support for that patient. So what does that look like? So how would I know that a patient's airway was compromised. What do you think they might present with?
They're gonna have something in their nostrils. I forgot.
So what would be in their nostrils?
It's gonna look like they smell something.
So they may have some singed nasal hairs, right? That could happen. What else might alert me to, I might need to check this or be on the alert for this patient's airway? What might I hear? What might I see?
Sounds.
What kind of lung sounds?
Wheezes?
Wheezes. Yes, wheezes. So, okay, so let me put another little element in there to help you out a little bit. So, I am a patient and I was in my house, and for whatever reason, I woke up and there was smoke in there, and I got burned, and now I'm burned about over 36% of my body, and I'm coming in, and I am what might you expect you might want to check out? I was in my house, smoke-filled house.
Lungs and airway?
Lung sounds and airway, but why?
Carbon
Why?
monoxide poisoning.
That poisoning, but then I might have some inhalation, right?
Yeah.
So
But
if
like
I'm
swelling?
That's right. So I'm going to, so what might that manifest? So if I've inhaled smoke, that smoke is going to irritate what?
Your esophagus and cause
Yeah.
swelling?
So I may have some swelling, but I may not have swelling. But what might I have? If I start talking like this, would that alert you? If I was talking really hoarse, would that alert you? Yeah,
Oh, yeah.
that should alert you. Hoarseness. What about I'm breathing. Have you all heard stridor? Sounds like that. A very audible coming from the throat. Something now is either in there or something is impeding. It's swelling or something. That stridorous sound that you might have heard. So I would want to pay attention to that. What else? What else might I see or hear? Let's think about it. When something gets in your throat, what do you do?
Cough.
You cough. That's right. So a lot of coughing. I might hear a lot of coughing. So in the first 24 to 48 hours, a lot of times when people are burned over significant portions of their bodies and they are not sure if they had any inhalation, maybe I was unconscious. You don't know if I really inhaled, but you know, when you hear they were in a smoked filled room, you probably should be alerted to the fact that, oh, okay, in addition to the fact that they are burned, they probably have some inhalation. Maybe that could be some damage, and I may want to think about securing the airway. Okay, that's just a hint to when you don't assume that the burns are the only thing that you need to worry about. You need to worry about inhalation and the effects that it has on the throat, on the lungs, the wheezes. You were dead spot on, whoever said that. The stridor, the hoarseness, the coughing, things of that nature. Swelling, certainly a telltale sign. If my face starts, if my face starts swelling, do I need to be worried about my airway? Absolutely, I do. All right. So I need to make sure that we're securing the airway. And what might I anticipate the doctor is going to do?
Intubate.
Intubate. So I need to be looking to assist with intubation. Is that if the patient's airway, if they're hoarse or they started to speak hoarse after, after a little bit of time, and now all of a sudden 24 hours later, they're starting to talk really hoarse. There you hear that stridorous sound, or they are coughing a lot. That's probably going to be a intubation that is a difficult airway intubation, right? So I'm we need to anticipate, maybe you go get the difficult airway cart, you know, that has some things in there that are specific to that. I won't get too deep into that, but you do need to be anticipating that they probably are going to want to intubate that patient. So we talked about the fluid replacements. Remind me again what that fluid was going to be.
Lactated ringer.
Lactated ringers or?
Normal saline.
Normal saline. Okay. And how am I going to infuse that?
IV.
IV. So what if my patients got burns all over their body? How am I going to get an IV?
The one that goes through the bone.
The one that goes through the bone, intraosseous. Is that what you said, Sylvia?
Mm-hmm.
Yeah, absolutely. We can do that. Or they may need a central line. They just may have to put a central line in that patient to be able to get them some fluid replacements. What kind of pain management am I going to be offering that patient? What are some medicines?
The strongest.
Okay, you're right. So what are some of those? Come on, you all going to be doing pharmacology. What are some of those strong opioids that we, patients always asking for?
Morphine.
And morphine is one. Yes. What else?
Dilaudid.
Dilaudid. That's right. That's hydromorphone, also known as Dilaudid. What else?
Fentanyl.
Fentanyl. Yes. What else? There's one more. They used to give it to horses.
Ketamine.
Ketamine. That's right. That's right. So we've got morphine on board. We've got Dilaudid, which is also known as hydromorphone. We've got what did we say? Did we say fentanyl? We've got morphine, we've got Dilaudid, and we've got ketamine. So we're probably going to be managing that patient's pain with all of that. What are some things that we might do to prevent infection?
Sterile.
Yeah, so we're gonna keep aseptic, right? Are we gonna be going in with our hands touching that patient? No, we're not. Are we gonna be wearing clean gloves? Or are we gonna be wearing sterile gloves? Probably we need to wear sterile. I read your lips, Janae. Yep, we're going to be doing some wound care too. That's not all those wound care items will not be on the test. I won't ask you about the Silvadene and all of that, but just know that, yeah, wound care is something that they would be getting those, maybe wet to dry dressings and, like I said, all of those other products that we will not be talking about on the test. Maintaining the body temperature, keeping them warm. You all already talked about maintaining the room warm and maybe a bear hugger or warming up the fluids with the fluid warmer and providing emotional support. That's going to be really important as well. Okay, so let's move on to the acute phase. Remember these hours too, because there might be a question about when do you do what happens at this certain hour of time. So pay attention to those hours. So the acute phase starts within 36 to 48 hours. So that's about 3 to 4 days into the burn injury. Okay, so that's when the fluid shift. Remember we talked about in the acute phase, the fluid shift into the interstitial space, and then you have the swelling and you have the loss of fluids and all of that. Well, at about 3 or 4 days, 36 to 48 hours, that fluid starts to shift back the other way. So it goes back into the cells where it needed to be. It goes back to into the intravascular. It goes back into the blood where it belongs. And so then those wounds begin to start to look like, depending on what kind of thickness it is, starts to close and start to begin to heal. So those nursing priorities that we really need to be looking at is to maintaining the cardiovascular, because people can start to have those kind of problems. So how would I do that? What would I be looking to evaluate or assess in terms of their cardiovascular health? What would I be looking to do? What am I monitoring? What's cardiac?
Their heart rate.
The heart. Yeah, I'm going to be monitoring what? Their heart rate. What else?
Pressure.
Their blood pressure, right? Okay. Heart sounds. What about respiratory? What am I going to be monitoring?
Lung sounds, crackles.
Crackles, wheezes, right? I'm going to be assessing that. What's going to happen now? Remember, I told you that everything is disrupted now because my coat has been compromised, and so everything is compromised. So what do you think my GI system is doing right about now?
Constipation.
Yes, probably slowed down. What do you think? Probably slowed down. I'm sorry, what did you say?
The ulcers or maybe an L.
So what do you think what might the doctor order for me in terms of my GI system?
Laxative.
Or not necessarily a laxative. Somebody said something.
Doc, you say sodium?
We might want them to poop, but what might they, if they're having motility issues, and they have that, what if they don't really want to eat, or their bowel sounds, or things are just not sounding really right? What might the doctor order for them?
Can you repeat the question again?
What might the doctor order as something that I might have to do to my patient just to monitor their GI system?
An ultrasound?
He's going to order all those tests, but there's something that you all have done that you've learned in skills. What might I'm sorry?
NG
tube? NG tube. Yes. Why? Why would he order an NG tube?
To decompress.
Yes, to decompress. That's exactly right. Yeah. So think about that. He might order an NG tube. Obviously, pain control is going to be maintained throughout. And then, the psychosocial interventions that you do, that means talking to the patient, giving them emotional support, talking to the family, making sure they understand what's going on, giving the patient some encouragement without being false and without giving them false encouragement, but, letting them express themselves and how they might feel. That's really what that means. Okay, so let's move to the rehabilitative state. And this begins when most of the burn area has healed. And this is when people are able to get up and move and their functioning returns and all of that. So this can take a long, long time because people, depending on the level of the burns, sometimes that rehabilitation takes a really, really long time. One of the things that we can do as nurses is to prevent or help the contractures, because if you are burned, let's say you burn a 3rd-degree burn, your hand contractures means that your hand may be formed like this and it may stay like this. So what can a nurse do to help prevent a contracture?
Professor Smith, I had a question on the acute phase slide you were last on. I had a question. It was an ATI. It was like the patient had burns on 40% of his body, and it was like in the acute phase of the burn. And it said what was, I don't think it was the priority, but what was like the nurse's action. And it was between two. It was bed rest. Well, I picked bed rest or keep the patient on bed rest. And then the answer was perform range of motion exercises. But I feel like this would be a very painful phase. So I don't, especially 40% of the body. Yes. That doesn't really make sense. So like, can you explain that?
Yeah, well, again, and they said this is during the acute phase that you want to do that.
Yeah.
So if they're saying that, then they mean that because we don't want to move to the rehabilitation phase when they're already contracted. So what you can do is help them slowly move range of motion so that they're not getting that. I didn't know that your ATI book said that that's in the acute phase, but that makes sense to me because you don't want them to develop the rehabilitation is when everything has healed. So if they're already like that in the acute phase, the rehabilitation phase is going to be more difficult to get that range of motion back. So that makes sense to me. Was that a priority question, or was that a—
No, it was just what would you do? Like what would be done during this phase? So would you never want to really keep a burn patient on bed rest?
You would want to, but you do want to get them to be able to move as much as they can move so that they can get to that rehabilitative state. So bed rest is fine, but when you don't move, you lose functionality, right? If I'm not moving, the body's made to move. So if I'm not moving, I'm losing. Think about the people that you all saw in the nursing homes. If they're laying in the bed, they're losing functionality. And these are not even burn patients, right? So you do want to increase the range of motion, because what is range of motion also going to do in terms of flow of fluids and blood?
Blood flow?
Right. It's going to increase the blood flow. So if I'm doing range of motion exercises, it's increasing my muscles, increasing the blood flow. So yes, that would be the right answer, because I don't want them laying in the bed not doing anything. I'm now creating a bed bound cripple. I do need to be actively helping them engage in range of motion. Is it going to be painful? Absolutely. But what's the other side of that? The other side of that is then they become bed bound with not being able to do anything. Does that make sense?
Yes.
We're always going to do, so when you look at that kind of question, we're always going to do that which is going to help them reach their highest level of functioning. Bed rest is good, but what's going to help them to rehabilitate? That's going to be exercising in that range of motion.
Would that like potentially damage the skin more that's trying to heal for a burn though?
So you would probably not be doing it on the skin that has, that is really been badly damaged. But you are going to have them try to, open up your hands as much as you can. They may not even be able to do that much. They may just be able to do that. But that little bit is still going to help them increase their range of motion, which is going to help healing, which is going to help blood flow, which is going to help functioning. Doing nothing is only going to make them stay where they are or worse.
Okay.
Okay.
I have a question regarding that.
Yes. Yes.
So you say like stage 4 is painless. At what part does it become painful? Like at what part of the phases does it start becoming painful to where if you do range of motion exercises, they are going to feel that pain?
Well, so it depends on how much of the nerve has been damaged. So it depends on the burn. If the nerves have been damaged, nerves can regenerate. We know that, right? Nerves can regenerate. So if the nerves have been damaged beyond all hope, then no, they're not going to feel that. But if there's some regeneration of nerve functioning, they're going to feel that. They're going to feel that because the nerves, they can regenerate. Those neurons those synapses can reconnect, and they will start to feel that as the healing starts to take place. It just depends on the level of the damage and where that damage is. Okay. So yes, it would be very painful. Yeah. Any other questions? Okay. All right. So let's see, where are we on time? Okay. All right. So can you all see that? Okay. So we talked about this already, but I wanted to make sure that you saw this and you knew. So because again, there will be probably some questions in regards to what's going to happen with the blood, with the blood and with the electrolytes and with all of that. So you know that we're going to have a decreased temperature in the first few hours because the body can't regulate the temperature. We talked about that. Remember that. They're going to have hyperkalemia. Somebody, I think it was Sylvia, that said hyper. That's right. So that's a result of the leakage of the fluids from the intercellular space. So they are going to be hyperkalemic. That means elevated potassium, and they're going to be hypernatremic as well, because now we're going to be holding on to the sodium. And remember, it's going to be in the interstitial space, and thus you're going to have sodium retention. Fluid follows sodium. So what might you see? fluid follows sodium. It's going to be in my body. So what might I see?
Edema.
That's right. Edema. That's right. And then the hematocrit is going to be increased because there's going to be hemo concentration. That means because it's not coming out, you're going to see that it's going to be concentrated. So that means the hematocrit is going to go higher. Okay. All right. So we talked about this. So burns and airway, signs to look for. So the progressive hoarseness we talked about, that's something that's going to alert you. This patient might have an airway problem. The brassy cough. Somebody said that. Difficulty swallowing, drooling. Nobody said that, but that would be definitely a sign. Adventitious breath sounds. So that means it sounds that are wheezing or rhonchi or that stridor that we talked about. Audible wheezing. If you don't have asthma and you start to, you're wheezing, then and they've been burned, yeah, you probably want to think about, we might have to intubate this patient. The high-pitched voice change, burns on the neck or face, big telltale sign that they may have inhalation. They may have inhaled smoke, and thus they may have some airway problems. The singed nasal hair, I think somebody said that. And then the blistering. So if you're seeing redness around the mouth or blistering in the mouth, or because you got to look everywhere, right? You're going to look in the nose. You're going to take a pen light. You're going to look in the nose. If you see the singed nose hairs, you're going to look in the mouth. If you see blistering in the pharyngeal mucosa, then that's going to be a telltale sign that, if it's blistered and it's red now, it may get progressively worse, and I may need to be making sure that I'm checking the airway. What are some ways to check to see if a patient is oxygenating well? What would we be looking at?
O2 stats.
That's right, O2 sets. So I want to make sure that my O2 sets, I'm paying attention to that, to those numbers. So if it gets to be, if they were at 98 when they came in and they're at 90, do I need to be concerned?
Yes.
Yes, I do. I need to be concerned if that O2 sat is starting to go lower. All right. Okay, so these are the nursing interventions that you need to be paying attention to and to anticipate. So for the respiratory system, you want to check respiratory rate. If somebody's breathing and they're doing this, is that normal breathing? Is that normal?
No.
No. So we need to pay attention to how my patient is breathing. If they are too tachypnic, then that is not good. If they are, their breathing is too slow, that is not good. So that may be an indication that something is going on here that is restricting them being able to breathe. So humidified O2 is something that you sometimes see in burn patients. They may have a chest tube because maybe the inflammatory response set off, fluids start to leak out of spaces that they shouldn't have, and sometimes they find themselves in the lungs. And so they may want to put a chest tube in that patient too. The lung may collapse, so they may want to put a chest tube to reinflate the lung or give the lung a chance to reinflate. We can also have the patient do some coughing and deep breathing. And what might we use to be able to promote that?
Incentive spirometer.
Incentive spirometer, that's right. And we talked about the cardiovascular and checking the blood pressure. If a patient has burns on their arms and their hands, I want to check their pulses, right? I want to make sure that their cap refill is what it should be, less than 3, right? I want to check what somebody said, their pulse ox as well. For the fluid replacement, somebody mentioned that interosseous. Yes, we're going to go get that IV access any way we can. If you can get a large bore IV, you're going to get 2 large bore IVs in that patient or a central line. Okay. And then we talked about the third spacing. Actually, we didn't talk about third spacing, but we talked about the fluids leaking out. And so resulting in the electrolyte imbalance, which is why we're going to give them crystalloid fluids. Crystalloid fluids. What's a crystalloid fluid? What's a crystalloid? You said it and you don't even know that it's a crystalloid.
And all LR.
LR, right? And what else? Normal saline. So when they say, what type of fluids would you give them? Crystalloids. You know they're talking about normal saline and LR. Okay? If they start talking about at a certain phase, you're going to give the patient colloids. Colloids. What are colloids? Those would be your albumin and plasma. So if the question reads, what crystalloids are you going to give? And the choices are albumin, normal saline, D5. What would you choose?
Not D5.
You would choose which one of those is a crystalloid. So the choices are normal saline, albumin, D5. Which one is a crystalloid? Normal saline. That's right. If the question reads, which colloid are you going to give them? Are you going to give them LR? Are you going to give them plasma? Are you going to give them TPN? Which one is a colloid?
Plasma.
Plasma. Okay, remember that. What's a colloid and what's a crystalloid? Okay. Okay. All right. So here it is that we just talked about. So the fluid resuscitation portion is going to start the first half of the 24-hour, after the first burn injury. After the first 24 hours, we're going to be resuscitating them within the first 8 hours after the burn occurred, which is what I was trying to say. So we're going to infuse the crystalloids. There it is right there, normal saline or lactated ringers. And then after the first 24 hours, we're going to give them colloid solutions, which is albumin or the plasma expander. So that albumin has got some things in it that's going to help them to start healing, to start the healing process. We're going to keep the patient warm, keep the wounds covered, pain, morphine, all of that we've talked about. So that's there for your for you to kind of review. All right. We've also talked about this, the NG tube. You might see that when I listen to the bowel sounds. We're going to measure the eyes and nose. We didn't talk about a Foley catheter. Might we put a Foley catheter in? You betcha. Absolutely. If the patient is burned over significant portions of their body, are they going to be able to get up and down to the bedside commode or get to the bathroom? No, they're not. So we're definitely going to make sure that they have indwelling catheter in them. And then we're going to monitor that urine output for any discoloration. We would probably start to maybe see some very, very yellow urine because of dehydration, and maybe they haven't been resuscitated enough. And so we're wanting to look for that. And also when you're testing the urine, you might see glucose in it because the liver is going to start to break down the glycogen stores. And so they may have sugar in their urine. So if you do a urinalysis, you might see, or if the lab did it, you might see that they have a high level of sugar in their urine. Okay, so some of the things that you also want to remember, because these will be probably test questions. I don't know if they'll be CMS test questions or they'll be maybe might be on the test. These are some things that you want to do to prevent infection in your patient. So we would not be having people bring flowers to them. Why? Because we don't want them to be at risk for Pseudomonas. That is something that kind of lives in the flowers, and so we would keep that away. We want to obviously limit visitors that are sick, have a cold or something. We don't want our patients, because they're already, somebody said, immunocompromised. And so we would keep them away. We want to administer any antibiotics if we needed to treat any infection. There's no specific one because we're not really talking about specific antibiotics in this case, because we don't know what we would be treating them for, but just know that they may get antibiotics. And then, of course, if you have to do any dressing changes, any wound changes, you would be using sterile procedure, strict asepsis with that, because you don't want to introduce anything into their skin. They already have staph on it. They may develop staph infections. We hope not. And then for the nutrition, we talked about that. So they're going to need a lot of nutrition because they're hyper metabolic and they're hyper catabolic. And so they're going to require an additional amount of calories. Pay attention to their caloric needs. They're going to double or triple sometimes in some cases. And they will need, as somebody mentioned earlier, a protein increase. So you're going to need to maybe promote a high protein diet. This is patient teaching as well as making sure that they get that, and also promote a diet that's high in carbohydrates. That's all going to help to promote healing and prevent the tissue breakdown that is probably already started to happen. Questions?
I have two questions. The first one, because I read the chapter and I don't think I understand when it's saying that it's gonna have glucose in the urine. That's gonna be an expected finding. So if it's an expected finding, are we gonna let the provider know?
Yes. Okay. So if you have a 4th degree burn, or a 3rd degree burn, all right. So everything is now going to go into a hyper metabolic state. Okay. So you're going to be secreting cortisol because you're stressed, that stress response, right? So your body is going to be putting out, it needs to put out the sugar so that your cells can get the carbohydrates. But when it can't find it, it's going to go to the liver because it knows. Remember we talked about when we were talking about kidney, and if it can't find it in the kidneys, it's going to start looking because the body needs energy, right? Because you're in this hyper metabolic state of being burned. Your metabolism is going to go up. It's going to need the protein. It's going to need the carbohydrates. So when it's in that state, it's looking for wherever it can get sugar, because sugar is energy. You follow me so far? So it's looking for that sugar, and it just so happens that the liver has glycogen stores in it that can break down into sugar. So it will go to the liver. The body is searching for that sugar source. It can't find it anyplace else, so it's going to go to the liver. The liver is going to break down the sugar. The sugar is going to get peed out by the kidneys, and you're going to see the glucose appearance in your urine. Does that make sense?
Yes. When you mentioned about the cortisol levels and because you're stressing a lot, then yes.
You said, I'm sorry, you said what?
Yes, I understand now because the body is in a lot of stress. That's why it's gonna be hyperglycemic.
That's right. That's right. Any other questions? Okay. All right. Okay. This goes over what we talked about. This just gives you what is going to be increased. I do want to just mention this. Remember, and Sylvia, I just answered that the glucose is going to be elevated because of the stress response. So the body is looking for glucose. But I do want to focus on one thing here. The WBC. So these are some of the tests that they're going to order. Okay. And so they're going to order a CBC. What happens when the body has an injury? What happens with the blood cells, specifically the WBCs?
They increase.
They increase, but why do they increase? What is it about the body? What is it about injury that makes that? What do the white blood cells
Flight response?
I'm sorry?
Like a fight or flight response?
Not necessarily a flight or fight response, but it is, remember, the white blood cells are going to always go to the site of infection to try to heal it, right? So they're going to be increased. And I just wanted you to be aware of it's the white blood cells that are going to be, okay, something's going wrong over here. We need to increase so that we can go and start trying to heal whatever that might be. That inflammatory response, that infection, white blood cells are going to be increased. I just kind of wanted you to tie that in when you see why would they be doing a CBC? Because they're looking for, they're going to see, that would be an expected finding that you would see that WBC increase. Questions? Okay. Yes.
Sorry, I have a question. I may have misheard you earlier, but I thought earlier you said that sodium increases, but here it says sodium decreases. Which is it decrease?
The sodium is going to decrease. Did I say hypernatremia? It's hyponatremia because of the third spacing. So it's moving out into your skin, the edema. So it's moving out of where it needs to. So you would be hyponatremic in the resuscitation phase. Remember the phases though. Remember the phases that we're in. So it's going to be decreased because of the third spacing. So now sodium's moving out, the fluids are falling out with it. And so you're going to be hyponatremic. You're going to be hyperkalemic. So just follow this because this is right from your book. This is right from your book. And so that's what you're going to see in terms of your labs. And these are the labs that they're going to run. And so that's what you would be expecting to see from that. I might have put that hyper, so I'll go back and check my slide and check that. Thank you, Michaela. Okay. Okay. All right. Do you all know about the Parkland formula? So the Parkland formula is something that they use to determine how much fluids you give a patient after they've had a burn injury. So you take their weight, you convert their pounds to kilograms, and then you use this formula to be able to determine how much fluids they are going to get within the first 24 hours. And then you may even have to divide that in half to determine, that's a pretty dog, how much they're going to get in the first 8 hours. You will see this probably on a test. So when I move to the questions that I'm about to move into right now, we'll do some practice with this. Okay. So I am going to, let's see. I'm going to move to the questions, but I wanted you all to have this, I wanted you all to have this PowerPoint. So give me a moment. Let's take a little bit of a break for about 10 minutes. We'll come back and then I would have sent you this because when we go through the test, I want you all to have this so that you can refer back to this when you're taking the little test that we're going to go over. Okay, so let's take a break for 10 minutes. So we'll be back at 7:28. Okay, it's 7:18 right now. Okay.
Thank you for the email.
I hope I got everybody on the email. Uh-oh, I think I didn't, Janae. I don't know if I got you. Let me let's see. Let's see who else is on here. There's some Maddie. Uh-oh. Okay. So I think I missed a couple of people. Let me go ahead and forward it to who didn't get my email.
I didn't get it.
Okay, so who is that?
Sorry, Maddie.
Okay, Maddie, Maria, Carmen, you probably didn't get it. Okay, let me
have it.
You did?
Janae didn't get it either.
Yeah. So let me let me go back into my email and send it to, I thought I got everybody, but I didn't. I apologize. What I want you to do with this, when you get it, because I'm just looking at the time and I realized, wow, that really went by fast. So I sent you, I'm going to be sending those that didn't get it, but I will send it to you. For those that you did get it, you got also another email, I think, with some questions, right? Did you get the second email?
I don't think I got any emails.
I got it.
Okay, so yeah, I'm going to send it to those of you that didn't get it. And so what I want you to do with those questions, because I did not put the answers on those questions, but I want you to answer those questions. And then tomorrow when we meet, I am going to give you the answers, but I would like for you to try to answer them without looking at the PowerPoint. All right, so let me go back here and
there's only 9 people that you sent it to.
Okay. All right. So I'm going to send it to the rest of you all. Hold on one second. And I will do that. Okay. Let's do this. Okay. Okay. So I missed you, Maddie, right? Maddie there. Okay. And I missed you, Janae. Is that right?
Yes.
Okay.
Also me.
Janae Reyes. Okay. I missed you, Aaliyah.
Yes.
Is that Aaliyah's voice? I don't
Yes,
know why I know
ma'am.
your voice. Okay, Aaliyah, there you are. Who else did I miss?
You missed me.
That's Michaela, right? Is that your voice?
Yep.
Ah, I'm good. I'm good.
I didn't get it either.
Michaela. Okay. Who say that again? Let me see. Oh, yes, I know who that is. That's Carmen. Okay.
Yes.
Okay. All right. Maria. Where is your name on here? Let's see. Maria. Guzman. Here you go. Okay. All right, so you're going to get let me just add, see if I can add that as well. Just that. Okay, let's send you that. I sent you, those of you, I sent you the Word document first with the questions, and now I'm going to send you the PowerPoint. Tell me when if you got that.
I got it.
Okay, good. All right, so now,
I got
okay, very good. Now I'm going to send you the PowerPoint. All right. Okay, all right. So in the last few minutes, as I said, you should be getting that momentarily. Everybody that didn't get it, I apologize. Let's go back to the Zoom. Okay, there we go. Okay, let me know if you got that. Joyce, okay, I need to add Joyce because I see that Joyce has joined us. Can somebody, Joyce, are you there? And Alyssa.
Yes, I am. I
Okay,
just
you
got
all,
here.
okay, you all did not get the emails then, right? That I just sent with the PowerPoint and the Word document.
I got it.
Yes, you got it, Melissa. Okay, but Alyssa and Joyce did not get it, right?
Why don't you just put it in the Canvas shell?
Yeah, I can do that. That would have been easier. But what I wanted you all to do is take the test, but now we're running out of time. So we will review the test tomorrow with the answers. But what I would like for you all to do, and yes, I will put it in the Canvas shell. I will have the answers tomorrow when we go through those. That'll be the first thing that we do, and then we'll go through the shock. Okay. Anybody have any questions of the content that we went over?
Are we having a review tomorrow too?
Yes, I'm going to be. So when we first met, I went over the plan. So the plan was going to be that we were, I didn't think that it was going to take as long as it did, but we got through burns, but we did not get through shock. So I figured we would break it up because the mind can only absorb so much. And so I said we would break it up and we would do a second session and we would go over the shock tomorrow. We have questions and then we'll do the questions and we'll go through the questions, dissect the questions, and then give the answers to the questions and the rationale. So tomorrow, so there was a vote and we said that we would meet again tomorrow at 5 o'clock. I'll create another Zoom meeting and then we'll go over the answers to the questions of the test I just gave you all, and then we'll do shock. And
Are
we'll
you still
record.
uploading the burns?
Yes, I'll put that in the Canvas shell.
Thank you.
Mm-hmm.
So just for clarification, tomorrow at 5 p.m., correct?
Tomorrow at 5 p.m. and I'm going to create another Zoom so you all will have that link. So you'll be able to, I'll put that in the Canvas shell as well.
Thank you.
So I want to be able to answer any questions. Was there any any concepts that you all did not understand?
What I asked you earlier,
thank
you for clarificating about the liposuria.
Absolutely. Absolutely. Okay, so if you don't have any questions, I do want to just kind of go over a couple of things with the last few minutes that we have. All right, so let's see. Now, in terms of the tests, we talked about burns. Let me put myself back on camera. I'm sorry, I didn't realize I was on. Okay, we talked about burns, but I did not go into the chemical burns or the thermal burns or, those kind of things, because I wanted to give a general overview. And so when I create more of the test questions, it won't be on specific burns. I'm not going to say, is this a electrical burn? I'm not going to do that. It'll just be about burns. It'll be how you manage that, or it'll be how you, the stuff that we've gone over. So I just wanted you to know that. And let's see what else I want to tell you about that.
Wait, are you creating the test? Or is
I will be
Johnson?
creating a significant portion of the test, yes.
Okay.
What I'm going over with you in terms of the burns and the shock, those will be my questions. And those will be the PowerPoints that I give you. The shock one will be tomorrow. Those will be, because I'm creating the test from your book, from your ATI book. I've got the ATI book because I know that I want to make sure that I crosswalk to make sure there are no discrepancies. And so what I'm giving you is either found in your ATI book or your textbook. So Dr. Johnson is going to be she's already, I believe, created some questions in terms of the bites. I think she told me bites, and what else did she go over with you all yesterday?
Nothing.
I think she went over something. Who told me? Who came to my office? Somebody came to my office, and I think she probably was not able to get on. But somebody came and she was talking about something. Everett, is Everett still with us? No, Everett's gone. Okay. So anyway, you all, does anybody remember what your PowerPoint was on then yesterday?
I don't even think she could tell you what our PowerPoint was on yesterday.
I think it had like Lyme disease, maybe.
Yeah, that was from the tick bites and the bites. But then she said she went over something else with you all, and she
like
said
snake bites. No, never mind.
Yeah, it was snake bite. It was the bites, but then she said there was a whole separate content that she said.
She tried to go over the tags, like the black, red.
That's it. That's it. That's it.
But it was not successful.
Okay. Okay. So it was not successful.
Speaking of the tags, on like the little thing that you gave us on what to study for, the tag said white.
I know, I didn't mean to do that. It should be yellow.
Okay.
Yeah, somebody brought that to my attention the other day. I was like, oh, yes, it should have been yellow.
Okay, thanks.
So just for clarification really quick, so you're just going to be covering burns and shock, and then and then the emergency preparedness that you send out and the moderate sedation, she's going to cover?
Well, I can cover it if you want me to. Did she go over that at all?
No.
Oh, okay. All right. I thought she said she did.
No, ma'am.
Okay. And your test, so your test is on next Wednesday, right?
The 22nd.
2 Wednesdays.
Oh, okay. I thought it was next week. So I was like, oh, shoot. Okay, this is good. Okay, this is very good. Okay, then, all right. So then tomorrow we'll meet. And like I said, we'll go over shock. And then we'll meet again. Let's see. So 2 Wednesdays.
I think
so maybe we'll meet
on Monday.
Yes. Okay, very good. So we'll meet on Monday as planned, and we'll go over the shock. Not shock, the resuscitation, the anesthesia drugs, and the intubation, and all of that. Yep, we'll go over that. Emergency. Yep, we'll go over that.
That means you canceling tomorrow, or we still going tomorrow?
No. Tomorrow is shock. So we have to meet tomorrow because that's the content we're going over. But we're going to meet on Monday as well. So we're meeting 3 successive days.
Professor Smith, I don't know if anybody else had this problem, but I wasn't able to open the PowerPoint.
Oh, okay.
Saying that like it's restricted.
Okay, I'll put it in the Canvas shell and you should be able to access it then. I'm not quite sure what's wrong with that, but I have it. And I'll just download it from my own desktop. I think it was probably, that was weird because I think that came from the cloud. I don't know why that's not working though, but I put it on my desktop, so I'll download it in just a second. Any other questions? I want to give you all time to oh, one of the things I did suggest, Alyssa and Joyce, because you all probably didn't hear, and maybe Dusty, you didn't either, or Carmen. I would like for you all, I know I sent you all and you will get the test, but I also would like for you all to at least do 10 questions off the internet. I don't care where you find them. They just need to be NCLEX questions about burns and do those. Okay. Because I want that information to be solidified. Once you get the PowerPoint, you'll understand, but I want you to read the PowerPoint and then look for 10 questions just to do about burns. You already have 10 questions that I've sent. So I want you all to do those, but do 10 extra questions, because that will help you to keep that information alive and for you to understand. Okay. So I'm going to go into, I'm going to stop recording.